Every minute of every day, in hospitals across Australia and New Zealand, surgeons work with other members of the medical profession to save lives. In 2013-14, Australia's public hospitals admitted almost 700,000 patients from elective surgery waiting lists. In New Zealand, there are nearly 160,000 patients receiving elective surgery each year, 40,000 more than there were 5 years ago. This does not include the surgical workload arising from cancer and traumatic injury. So, who trains our surgeons, and how do we ensure they are delivering the highest possible standard of care? The Royal Australasian College of Surgeons, or RACS, is a not-for-profit organisation that represents 9 surgical specialties and more than 7,000 surgeons and 1,300 surgical trainees and international medical graduates. The college also supports healthcare and surgical education in the Asia-Pacific region and is a substantial funder of surgical research.
Personally, I've gained the value of life and the ability to alleviate suffering.
It's a very special relationship you have with somebody of trust and respect, that they invite you into their world and allow you to operate on them. And that is a very intense way of life to live, and is very rewarding with a lot of job satisfaction because of that.
It's given me the opportunity to develop in areas of science, learn things, improve communication skills, and learn things like management and governance. So it's a very wide-ranging occupation that gives us lots of opportunities.
RACS has a long-standing track record in high-impact policy and advocacy. Our trauma surgeons work tirelessly to heal and prevent alcohol-related trauma, lobbying to reduce the availability of alcohol through hours, outlets and taxes. The RACS Trainees Association comprises the next generation of Australian and New Zealand surgeons. RACSTA is the voice of college trainees, who total around 1,300 across the specialties. The college is also committed to expanding the number of women in surgical training and to ensuring that training programs do not disadvantage them. The development of the Women in Surgery section and mentoring programs for trainees reflects that commitment.
I think surgery is bigger than what you think it is. It's not just about being a doctor in a hospital and going in and treating patients.
The human factor is very important in surgery.
Enthusiastic, you need to be committed, and you need to be prepared to give back to the profession.
I loved being on the wards, I loved going to theatres. It made sense to me that people come in with something wrong, we were able to do something and they went out well.
RACS will not tolerate discrimination, bullying or sexual harassment and strives to facilitate safe, comprehensive surgical care of the highest standard to the communities it serves. Establishing an expert advisory group in early 2015 to recommend what RACS can do alone and with others to stamp out this sort of behaviour in surgery stands as one of the most significant milestones in the college's advocacy history. The EAG's final report provided a clear blueprint for the college's action plan to rid the profession of this behaviour and provide strong direction for other health industry organisations. The RACS Fellowship has grown dramatically in the last century, from fewer than 1,000 surgeons in 1949 to more than 6,500 fellows today. The FRACS acronym at the end of a surgeon's name is testimony to the fact that they are specialists in their field, having reached the exacting standards of training and examination as required by the college. Surgeons are uniquely placed to provide expert opinion on the health system and surgical care. Not only are they specialists in diagnosing, treating and curing medical problems, they are also integral in shaping the debate and influencing the development of Australian and New Zealand health policy. This is dynamic healthcare advocacy, and this is the Royal Australasian College of Surgeons.